We're fortunate to live in a time when there are specialists for everything, from heart doctors to dermatologists. But sometimes problems can arise if you're getting prescriptions from different practices. However, there is a way to make sure accidents aren't being made with medication therapy management. Pharmacist John Fry with Family Pharmacy tells us more.
Well, it's a system that's been put in place under the Medicare Part D laws to utilize the pharmacist's expertise to improve drug therapy and to maximize drug therapy. In other words, making sure that your medicines are doing what they're supposed to do and to make the outcome and the improvement in a patient's health the most, and to also pick up on problems and analyze them and solve them.
And there really can be a lot of problems because patients are going out there, they might be in the hospital, they might be seeing a regular doctor, they might be going to a heart specialist. You can get a lot of different medications from a lot of different people, and they might not know what the other person's giving them.
Yeah, and it's coordinated through your insurance company, which is the focal point of, even if they go to different doctors and different hospitals, is always the insurance that's going to be paying for it. So it's documented through their computer system. So the insurance companies have us analyze the situation and look for problems and try to just improve the patient's health, especially people that get many prescriptions per month or have different diseases such as diabetes, high blood pressure, heart disease. Another thing that we help a lot with is our hospice people, for giving compassion to the people that are dying and seeing that they're made as comfortable as possible. And that all coordinates through the Medicare Part D programs.
And it's really comforting to know that you guys are here and able to give this type of service, because I think the assumption is when you go to the doctor's office, the doctor's going to have all the right answers, and it's nice to know that you guys have the computer that tells you all the information about the medications, and you can follow up with whatever medications you might not have.
Yeah, or catch something that could be done better, or catch something that shouldn't be given with another medication. And it can be very gratifying at times to help someone and help them feel better and provide a better outcome to their life, or the quality of the life that they have.
And I was actually paying attention. You, a few minutes ago, noticed that some patient was getting 2 of the same type of medication. That's kind of scary. I mean, how often does that happen?
Not very often, but often enough that, you know, when you do catch something like that, it's gratifying to know that someone could have been hurt and you've done some small part in preventing that.
And tell me a little bit about Family Pharmacy and what you all do.
Our emphasis is on service instead of stockholders, so to speak. When you go to a large corporation like the chains, their eye is always on just the bottom line, or making their stockholders happy, and we realize that our customers write our paycheck, and we try to provide service on a family level. We're called Family Pharmacy, and we treat you like family.
And that's wonderful. And one more question too before I forget. You know, you get medications sometimes through the mail. That doesn't make me feel very comforting to the thought that, you know, you might not follow up with somebody that way. Is that true?
Yeah, that's very true. I personally feel that mail order pharmacy can be a threat to people's health in a way. But again, it's all guided by the almighty dollar, and that everyone has to save money, and it can be dangerous, and there needs to be someone that can review a patient's medications and make sure they're not getting the wrong thing from a mail order that's being given by another doctor somewhere.
And the Family Pharmacy group itself is hugely popular, and since you guys aren't really a chain in itself, I'm very surprised every time I come out here, just the mass of people and how successful you are and the amount of people you have working all the time.
We're your hometown pharmacy, and the people that are independent business owners, you just get a level of service and a real honest level of caring that you're not going to get at some corporation. So that's kind of the basis of what we do and why we do it.
And Family Pharmacy has several locations, as you can see on the screen. If you'd like to learn more information, you can call 276-627-0536.